Hello, my name's Jennifer Franklin. I am here to present to you emergency contraception options. Emergency contraception option would be Plan B one step. There's also a variety of other kinds, but we're going to focus on that one and that, and they usually act the same way, more some effective than others. Emergency contraceptive it uses various combinations of drugs to interrupt a woman's normal hormonal pattern and prevent pregnancy after unprotected sex. It's called a Plan B because you're supposed to take it after the Plan A fails, which we will get into that a little bit later. The Plan B one step works to prevent or delay ovulation, and it may interfere with fertilization of the egg. The pill does not cause miscarriage or abortion, and once the egg is fertilized, then the pill will not work. It protects up to 5 days after unprotected sex, and it usually takes about 6 days for the sperm and egg to meet after unprotected sex. It's also called the morning after pill, but it's recommended that you take it as soon as you have unprotected sex or have a mistake that happens. If you take the Plan B one-step pill 24 hours after unprotected sex, it is very effective. And if you take it within 72 hours, it's about 89% effective. But for all of you heavier, overweight, like myself, the Plan B is probably not your best option. The best option would be the IUD or the Ella, because when you have a body mass index over 30, then the pill may not work at all. The Plan B one step is definitely a short term. You use it when a condom breaks, you forget birth control, in any incident that you are raped, or maybe your partner didn't pull out in time, or your diaphragm slips out. These are all occasions in which you can use the Plan B one step. Plan B one step is not intended to be a long term, so do not use it as a birth control. And if you did, then that would get very, very expensive. The cost is $20 to $50, and it's available at health centers and drugstores with no proof of age. I mean, anyone can get it. The side effects are very uncommon. It's safe for most women, but of course advised to talk to the doctor before taking it. There's been no reports of serious complications. The disadvantage for some is that you might have a earlier or later period, maybe a heavier or lighter period than normal, breast tenderness, dizziness, headaches, nausea, and vomiting. In case of vomiting, if you do vomit 2 hours after taking the pill, it may not be effective, so you might have to take it again. So just in case. One of the big advantages is that it has decreased the number of abortions, which I think is amazing. If a friend asks me if what I would think about this Plan B, I would think that it is great for the ones that do have those mishaps if a condom breaks. Yes, I believe that the Plan B is definitely a safe way to prevent pregnancy, especially in those who do not want to get pregnant. But it should not be taken advantage of. For some, sensation without condoms or protection is better. But I would say that use the protection, the Plan A protection, and then if that does fail, then Plan B would be my number one. Thank you so much.